Good day everyone, my name is Janella Izza Guillermo from BSN 1B, and for today I will be demonstrating the vital signs procedure. For the assessment, assess any signs and symptoms that may affect the vital signs, assess the site for the measurements, the factors and the positioning appropriate for the procedure, assess the activity intolerance, chest pain, dyspnea, and the signs and symptoms of hypotension and hypertension. It is important to determine the policies and the procedure for the facility and check the client's record. So for planning, we need to assemble all the equipments and the supplies. So the stethoscope, sphygmomanometer with its cuff, thermometer with its cover, cotton balls, alcohol, and my watch with second hand. So now I will be doing the implementation. So good day ma'am, I'm Janella Izza Guillermo, your student nurse for today. May I know your name, age, and address ma'am?
Izza Guillermo. I'm 41 years old from Palayan City.
Okay ma'am. So now ma'am, I will assess your vital signs to detect medical problems in your body and to know if your body is healthy. So now after explaining and introducing myself to the client, I will do proper hand hygiene and provide client's privacy. So now place the client on the position that they are comfortable. So now the first vital signs that I'm going to do is getting the temperature of the client. So we need is a thermometer. So first, clean the thermometer to the tip from the tip to the body with cotton balls and alcohol to disinfect it. Then after that, I will place the thermometer on the appropriate site. And then wait until it indicates that the reading is completely done through a tone. So that I heard the sound, I will remove the thermometer and then clean it with cotton balls and alcohol again. And then disregard the cotton balls. So the temperature of the client is 36.4. So record it on the client's record sheet. So next is getting the pulse rate of the client. First, we need to locate the pulse point. And then, palpate and count the pulse within 60 seconds with 2 to 3 middle fingertips over the pulse point. And then assess the volume and the rhythm of the pulse. So the pulse rate of the client is 72 beats per minute. Next is getting the respiratory rate of the client. So if you anticipate the client's awareness for respiratory assessment, you may place their hands on their chest or across their chest to feel or observe depth, rhythm, or character of respiration. So I will count the respiratory rate of the client within 60 seconds. Remember that the inhalation and exhalation count as one respiration. So, yeah. So the respiratory rate of the client is 15 breaths per minute. Now, the last vital signs that I'm going to do is getting the blood pressure of the client. So first, place the client on the appropriate position. And then, wrap this cuff around the upper arm of the client and locate the brachial artery. And then apply the center of the bladder over the artery. Remember that for adults, that place the lower border of the cuff 1 inch above the antecubical space. If it is the client's initial examination, I will perform the palpatory determination of systolic pressure. So now for the stethoscope, I will wipe the two earpiece with cotton balls and alcohol. And then I will wear the stethoscope and ensure that the stethoscope hangs freely from ears to diaphragm. Then now I will close the valve by turning it clockwise. And then place the bell on the pulse point. Ayan. Then I will pump this until I cannot hear any sounds. Then I will release the pressure carefully. Okay, wait until 1 to 2 minutes before making measurements. So now for the diastolic pressure, I will wear again my my stethoscope and then close again the valve by turning it clockwise. And then place the bell on the site, pulse site. And then I will pump the sphygmomanometer until it reads 30 millimeters of mercury above the point where the pulse disappeared. And then I will release carefully after. Okay. Now that I'm done, I will remove my stethoscope and the cuff from the client. And then disinfect all the materials with cotton balls and alcohol. So the total blood pressure of the client is 120/80, which is normal. So for the documentation and evaluation, document all the data on the client's record sheet and report any abnormal results on the primary care provider and document all the procedure on the client's record. So that's all for my return demonstration for assessing the vital signs. Thank you for watching.